In this era of advanced technology, people know more of their latest gadgets than their health disorders. Due to our busy schedules and unhealthy lifestyle, we often complain of loss of memory, sleeplessness, tiredness, and blurred vision. All these could be symptoms of some neurological disorder or disease that may affect the brain and central nervous system. An eminent neuro expert, Doctor Krishan Avtar, in a detailed interview with News.com, talks about neurological disorders, its symptoms, treatment and prevention.
Neuro-related disorders are basically comprising of diseases of the brain, spinal cord, nerves and muscles and their related disorders. They can be further classified into preventive neurology, curative neurology and rehabilitative or restorative neurology. We at Synergy Institute of Medical Sciences are having the department of neurology and neurosurgery separate, and with all other support services like neuro-ophthalmology, neuro-otology, neurodiagnostics, interventional neuroradiology, neuropathology, etc. Ideally, in every condition, the early diagnosis averts tragic situation later on. But it is more true in case of the paralytic attack, means stroke or brain attack, in case of head injury or any kind of spinal injury, in case of any kind of nervous system infections like meningitis, encephalitis, in many kinds of brain tumor and various forms of dementias where the cognitive functions are declining. Ideally, many conditions can be self-diagnosed and rather it should be promoted. For example, a patient of a stroke self-diagnose if he or she is having difficulty in speaking or understanding, any weakness or numbness in any part of the head, face, limbs, or sudden severe disease spell or sudden severe headache. If the person is having some kind of fainting attack or jerk, then one must suspect a kind of epilepsy or seizure. So, in many conditions, if the person or their family members are alert, they can at least suspect the condition and they can at least go to a proper doctor. That is a very important question. Alzheimer's disease is a prototype of dementias. Dementias are the condition in which there is a progressive decline in the acquired intellectual functions of a person. Basically, these conditions are mostly caused by certain neurodegenerative conditions, or they can be caused by impairment of the blood supply to the brain. Usually these illnesses start very slow and the findings are very subtle. Initially they are just a forgetfulness or difficulty in performing day-to-day activities related with the recent memory, planning, reasoning, judgment or execution. Ideally, the family member or the person himself should have a high suspicion index. Not all forgetfulness are dementia, but at least even if a person is suspicious of forgetfulness or any decline in the previous acquired mental functions, they must go to a proper specialist to get checkup, because in early cases there are certain dementias which mimic Alzheimer's dementia and they are fully treatable, like deficiency due to vitamin B12 or thyroid disorders, or sometimes there are pseudo dementias like depression. They can be treated, fully treated. As far as the Alzheimer's disease is concerned, that is a relentlessly progressive neurological disorder, but in recent years there are certain drugs which, if instituted early, at least they can provide some good symptomatic relief, or they are claimed to reduce or retard the progression of the illness. So, it is of paramount importance to find out early, to suspect early and to intervene early. As such, if you ask specifically, Alzheimer's cannot be prevented 100%, But definitely there are, by adopting a healthy lifestyle, by reducing various kind of stress, one can definitely try to prevent not only Alzheimer's but many other type of dementias. Epilepsy is a worldwide disease, and epilepsy or mirgi, what you commonly call, is basically tendency of getting recurrent fits or seizures, usually 2 or more at 6-month interval. Basically epilepsy is fairly common, and in most of the epilepsy the exact cause is not known, that we call it as a generalized or idiopathic epilepsy. What we see in our country is this tapeworm cyst, neurocystic sarcosis is one of the common cause that we already see, they also see in this part of Uttarakhand. Head injury and various cerebrodegenerative disorders, CVAs, they are the other common causes of epilepsy. What is important for the patient of epilepsy is to properly diagnose whether it is epilepsy or epilepsy-like condition, and to institute the proper treatment for sufficient period of time, because if the patient leaves the treatment in between, they can have a recurrence and they can get refractory epilepsy, and there are certain conditions in which the epilepsy is not that harmful, but the patient may get fall or may get injury due to epileptic fit, and that can be fatal to life. Basically, sleep apnea is a condition that should be ideally treated by a sleep medicine expert. Ideally, this condition is that when the patient sleep, there is laxity of the tissue of the soft palate, and the basically air entry is obstructed, and patient is getting disturbed sleep. Patients used to get frequent awakenings many times in the night, of which he is not having any conscious recall. What happens, that the hallmark of the disease is that the patient is getting excessive daytime sleepiness and easy fatigability and difficulty in concentration. The patient may get sleep while driving, while working in the office, and usually these patients are overweight, diabetics, alcoholics. These are the factors which further add to the misery. It will basically, you have to really identify whether it is a proper sleep apnea. There are many kinds of sleep apnea, in which the obstructive sleep apnea is the most common. This is usually diagnosed by a test which is called a sleep study or polysomnography, in which the patient is hospitalized and a proper sleep study is done, and basically by analyzing the record, we know whether the patient is having interruption in the sleep, and mostly these patients are prescribed a device that is called a CPAP, continuous air pressure device, CPAP device, and that patient use daily. Initially it looks cumbersome, but patient is getting, the quality of life is greatly improved, so the patients are using the CPAP machine. Diabetic neuropathy is basically dysfunction of the peripheral nerve in a patient of diabetes mellitus. Usually there are certain neurochemical changes that basically results into decreased performance of the peripheral nerve. It usually presents as the weakness of the limb, numbness, especially in the distal part, and there is a cotton wool like sensation, or pricking or needling like, or sometimes burning sensation. Ideally, the most important prevention is the proper control of the diabetic status. Secondly, there are certain drugs which are prescribed to provide a symptomatic relief in the diabetic neuropathy. It is severely affecting the quality of life. But the first and foremost is to have a proper diabetic control. Basically, curative treatment, first you have to control the underlying cause, that is the diabetes, and secondly there are some specific medicines which reverse the actual pathophysiology, but still the most important is the proper control of diabetes. Basically, encephalitis is infection and inflammation of the brain. Usually it is caused by a virus. For example, in eastern part of India we have a Japanese encephalitis. Every year outbreaks are there in the area of the eastern UP. Basically, these all encephalitis present with a flu-like symptoms or common cold-like symptom like any other viral illness. But when the patient is having a very kind of severe headache, or there is slight deterioration in the conscious level, or there are kind of fits or epilepsy kind like symptoms, then these are the red flag sign, and one must not wait and go to a proper specialist to get a proper treatment. Basically, the medicine and media can hold hand to fight the diseases, to fight the myths about the diseases, and they can educate the people before. If you have a proper knowledge about anything, so half the battle is won. There are many malpractices in the society in the form of drinking, smoking and many other eating disorders. So, let us educate our society, let us basically come together to provide a quality of life, a good quality of health care, wellness. I think it is the right time to handhold the medicine and media together. Prevention is better than the cure, and awareness coupled with the proper action is the key to prevention. That is the message I want to pass to my audience.